How do you monitor for breast cancer after prophylactic mastectomy? When someone chooses to have a prophylactic mastectomy to lower their risk of breast cancer, it's important to understand how they can keep an eye on their health afterward. While this surgery significantly reduces the chance of developing breast cancer, it does not eliminate the risk entirely. So, ongoing monitoring is still a key part of long-term care. The first step is regular clinical breast examinations. These are physical checkups performed by healthcare professionals to look for any unusual changes in the chest wall, skin, or reconstructed breast area. Even after a prophylactic mastectomy, small amounts of residual breast tissue might remain, and although rare, these tissues can develop cancer. Regular exams help catch any abnormalities early. Imaging tests are also part of the monitoring process, but their use depends on the individual case. For women who have had both breasts removed, routine imaging of the chest wall or reconstructed breasts is usually not recommended because the risk of cancer is very low, and imaging might not be very effective in this context. However, if some breast tissue remains or if only one breast was removed, annual magnetic resonance imaging scans or mammograms of the remaining native breast tissue might be advised, especially for women with high risk factors like BRCA gene mutations. Before surgery, magnetic resonance imaging is often used to identify any hidden cancers that might influence surgical planning. After surgery, MRI has limited use for routine surveillance but can be helpful if there are suspicious clinical findings. It's important to note that after a mastectomy, some imaging techniques and procedures like sentinel lymph node biopsies are not feasible because the breast tissue has been removed and the lymphatic pathways are altered. If only one breast was removed, the remaining breast needs continued monitoring. This usually involves yearly mammograms and possibly MRI scans, depending on personal risk factors. Patients should also be educated about what signs to watch for, such as new lumps, skin changes, or unusual pain, and should report any concerns to their healthcare team promptly. Even with a prophylactic mastectomy, the risk of developing breast cancer is reduced by about 90 to 95% in high-risk women, but it is not zero. That's why ongoing follow-up with a team of specialists including oncologists, surgeons, and genetic counselors is essential. They can help develop a personalized surveillance plan based on individual risk factors and surgical details. In summary, monitoring after prophylactic mastectomy involves regular physical exams and targeted imaging if residual tissue remains or if the other breast is still present. Routine imaging of the reconstructed breast or chest wall is generally not necessary due to the very low risk. The key is staying vigilant, knowing what changes to look for, and maintaining close communication with your healthcare providers to ensure any issues are caught early. Remember, each person's situation is unique, so personalized advice from your medical team is always the best guide.